Africa. So what is important for Mpox? So early symptoms of Mpox include fever, malaise or kakapoy, headache, sore throat, cough, and swollen lymph nodes sa inguinal area. Lymphadenopathy is a characteristic feature of Mpox. So ayun, as I mentioned, lymphadenopathy is a characteristic feature of Mpox. So ayun, as I mentioned, it's usually found in the neck, the armpits, and the groin. The incubation period is 3 to 17 days. And during this incubation period, pasabot nag-incubate pa lang ang virus atong lawas, the patient is not yet contagious. The illness, if a person do get infected, it usually lasts between 2 to 4 weeks. Okay, so Mpox symptoms start within 21 days of exposure. This is important because when we suspect someone of having Mpox, we require them to get isolated for 21 days. So nga naman, because that's the incubation period. So if with flu-like symptoms, the rash will usually develop within 1 to 4 days. So a person can spread Mpox during this time, from the time the symptoms start until the rash is fully healed or scabbed. And then sometimes 1 to 4 days before they have symptoms, spreading infectious na sila. So for close contacts, so for example, you were close to someone with rashes that are consistent with Mpox, we watch out for symptoms for 21 days of the last exposure. So people with Mpox can get a rash on any parts of the body. Okay, so a person is contagious until after all the scabs on the skin have fallen off. So while naapa sila lesions, any form of lesions, and the person is still contagious until all the layers of skin have sloughed off. Okay, so how does it spread? So we need to understand how it spreads for us to be able to prevent it or protect ourselves from it. So the predominant mode of transmission is prolonged skin-to-skin contact. So direct skin-to-skin contact with an infected individual, particularly close embraces, kisses, cuddles, or sexual contact. It can also be transmitted via surfaces contaminated by the skin lesions of patients with Mpox. So like what? Sharing towels or bed linens. So what I want to emphasize here is going to massage spas. So if the massage spa does not change the linen and somebody with Mpox lesions occupy the bed, so that can be a mode of transmission for Mpox. What else? Pregnant women with Mpox can pass the virus through by giving birth to the fetus and direct contact with an infected animal. So in the Philippines, no confirmed case of Mpox in an animal. Okay, so this I also want to emphasize. The disease is not known to spread in settings where only respiratory spread is possible, like across rooms, like this session hall, in markets or classrooms. So according to the CDC, the virus can be found in respiratory droplets, pero very small amount. Paano? Very close to each other for very long periods of time. However, the CDC did not specify kung how close and how long ang long periods of time. Pero the PISMID has a clearer recommendation. PISMID is the Philippine Society for Microbiology and Infectious Diseases. So Mpox is not known to be transmitted via airborne route. So across rooms, marketplaces, and offices. Therefore, compulsory masking in these areas or in the broader community is not necessary. Enforcing masking is not cost-effective and will not prevent the spread of Mpox. Why? Because mechanism of transmission is via direct skin-to-skin contact. Okay. So how do we prevent Mpox? Avoiding close contacts with individuals with rash that looks like Mpox. Observing skin hygiene and avoiding objects used by patients or persons with Mpox, and maintaining good hand hygiene by washing our hands all the time or using hand sanitizers or alcohol. So avoiding sharing personal belongings like beddings, towels, or utensils with other people, and consulting a doctor immediately if you ever find yourself having a rash, and avoiding self-medication. Okay, so if and when we encounter someone with Mpox, the recommendation is to allow only one person to take care of them, encouraging the sick person to clean their own rash with soap and water. And if someone with Mpox gets very sick, we advise them to be admitted in the hospital. Okay, so briefly, this is the screening checklist for Mpox according to the DOH. Okay, and I want everyone to be familiar with this, the Mpox case definition. So just like COVID, that we have COVID suspect, COVID probable, and confirmed COVID cases, for Mpox, we also have suspect case. So anyone who has been a close contact of someone with rash, with lymphadenopathy, and wherein the common causes of rash has been ruled out, suspect case siya. Probable case naman if suspect case with an epidemiologic risk like face-to-face exposure or healthcare worker, the person with the suspect or probable Mpox has had laboratory confirmation of the Mpox virus via real-time PCR. Close contact naman if the person who, in the period beginning with the onset of sources case and ending until the scabs have fallen off, had been exposed to the patient. So face-to-face exposure or direct physical contact or contact with the contaminated materials. Pag na-expose ka doon dito sa confirmed case, you are considered a close contact. And then discarded case if the suspect or probable case has had negative RT-PCR testing. So for the treatment, there is no proven antiviral drug for Mpox, no? So treatment for Mpox is mainly supportive and is directed at relieving the symptoms such as fever, body malaise, and exhaustion. Most individuals with Mpox will improve without antiviral treatment and will recover on their own. However, patients with other underlying medical conditions such as HIV may develop more severe skin lesions and may develop complications. For the vaccines, the Mpox actually has a vaccine, but the supply globally is limited. So the supply chain is directed towards areas where it is endemic, so in Africa. So the virus that causes Mpox is related to the virus that causes smallpox. So the Jynneos vaccine is available as a 2-dose vaccine that is developed against Mpox and smallpox. CDC has recommended vaccinations for people traveling to areas with Clade 1 outbreaks. It is worth noting that the vaccine is not yet available in the Philippines. So that concludes my short talk on monkeypox, and I hope we learned a thing or two about it. Thank you.
Thank you. Would a good doctor entertain questions from the floor? Mga pangutana?